my name is Jessica Taylor. I'm going to talk to you today about a piece of equipment that I developed to help support an 8-year-old girl with cerebral palsy in feeding herself. When thinking about a student with cerebral palsy, one of the most important things to consider is the positioning of their bodies. In order to address that, I used a floor sitter, just like this, and originally it did not have the 4-point harness, and so we put the 4-point harness in, which helps to support her while she is eating so that she doesn't have to focus on her overall trunk, and she can really just focus in on her arms and hands and the gripping and grasping. When she was using this chair, we noticed that she was kind of slouching to the right, and so I just took a pool noodle, and if I put this right in next to her, in between the right side of her back and the chair, it helps to give her a little additional support, which keeps her a little bit more straight. With this chair, she's also able to put her feet flat on the floor, which is spectacular, which allows her to give herself even more grounding. The second component to this overall adaptive equipment was developing something to help her with her grip. And so I found these really cool stretchy bands that just go right over your hand like this and attach on. And even if she lets go, it's not gonna fall. When she was using this with a normal spoon, I was noticing that as she was bringing it up to her mouth, she wasn't able to get it into her mouth. So I found this really cool swivel spoon that when she lifts things up, no matter how she's holding the spoon, it always stays where it's going to be able to get the food into her mouth, so it moves with her, which gives her some freedom of motion, which is spectacular. The next thing I noticed when we were doing this was that she was struggling with the spoon to keep the food on the plate and to get the food onto the spoon. And so I found this plate that has a lip to it right here, and so using the swivel spoon, the grip together allows her to scoop just like this, and as she's scooping, it stops her right here and pushes the food onto the spoon rather than falling off the plate. The one big struggle for her still is to be able to lift up the spoon. She needs to remember to push it back a little bit before she lifts it up. Once we got that kind of sorted out, I realized that what she really needed to do was also to be able to drink. And so using the similar system as the spoon, there's an adaptive grip just like this that allows us to kind of help attach it to her arm or her wrist or her hand so that she's able to, without having to grip onto the cup, she's able to bring it to her face. And I also found these really cool sip tips that work on her oral motor skills, and so it allows her to bring up the straw to her face. Sometimes she needs just a tiny little bit of assistance to get it into her mouth, but then her mouth goes like right around this part, and this circular part back here requires her to put her lips together and during that sucking motion, which really helps to work on these muscles right in here. So using the adaptive sitter, this awesome spoon, this plate, and this cup, she was doing a spectacular job with being able to eat, which was great. There was one struggle that she was having, which was at a regular table, it was very challenging for her to see what she was going to be eating because of the height of the chair. And so I'm going to bring the camera over to the adaptive desk that I found, which is really spectacular. Hold on just a sec.